Thank you for joining us this afternoon. Dr. Halu is going to talk with us about our speech language pathology master's degree. Could you briefly cover what is speech language pathology and who might be interested in this field?
Sure. So building on the basic curriculum that Dr. Messick and Mr. Bodnar just discussed in communication science, once you have that as a foundation for understanding what normal looks like, you can then start to understand how anything in voice, speech, language, even cognitive communication can come to be impaired, whether that's through a stroke or some kind of syndrome or traumatic brain injury, and so on. And so speech language pathologists diagnose and treat disorders of communication as well as swallowing disorders. And so, I always say human communication is like the dark matter of so many fields. So we might pull in people who are interested in education, special education, allied health in general, pre-med, linguistics. I have students in my lab in neuroscience and neurobiology, as well as psychology. So while everyone getting a master's in speech language pathology has to learn to be a generalist and treat the gamut of communication impairments as well as swallowing disorders, they can come to specialize in ways that can be really targeted and in line with these other fields as well.
So we've heard, and it's on the website, that there's something for everyone in the field of speech language pathology. In what ways is that true to you?
Yeah, well, so we know so little about any one communication phenomenon and associated impairments. And that's not to say we don't have a rich body of knowledge within our field, just that these are complex topics. And so one can spend an entire lifetime just trying to understand stuttering, or just trying to work with to advance, pediatric feeding and swallowing impairments, et cetera. And so if you find that, you've done maybe a half a lifetime in voice disorders or something like that, you could go get continuing education and go into something entirely different under the umbrella of the role of speech language pathologist. And so, we have 9 major content areas. So think about child language development and some of the other things that I've already mentioned. And you could specialize within those, or you could be a generalist and see just about everything that comes through that would be experienced within the population. So a lot of rural speech language pathologists, for instance, have to be outstanding generalists because they don't have specialists they can refer to. So you can be very specialized, very general, and either way, there is no end to the amount of things we need to learn.
So what types of students, what characteristics would make a student a good fit for Pitt's SLP program?
Well, I always say a desire to help people is absolutely necessary, but not sufficient. We also need people who have a deep curiosity and a desire to be lifelong learners, who are good at critical thinking, who have a love of science, who have strong writing skills or the potential to develop them. I would say that those are some of the big ones.
And these 2 concentrations that we have listed here, these are a newer addition to the program. They haven't been around for terribly long. Could you tell us a little bit about them?
I developed and direct the clinical concentration in voice disorders. And the idea here is that while it's our job to graduate people who are able to be generalists, who could treat just about any patient that comes through their door, there are specialty areas. And a lot of students know, I want to specialize in voice. I was one of those students. And there's actually no clear path for specialization in the field. It's kind of up to each person to say, I want to specialize, and they have to carve their own path. And so our clinical concentrations are an attempt at making that path more clear and more supported for students. It also gives us the ability to leverage some of our historical and current strengths. Like if you want to do voice, as an example, Pitt CSD is one of the top places you could go because we don't just have one voice specialist as is usually the maximum for most schools. We have multiple. So we're leveraging the current strengths that we have, and we're kind of trying out these models to see if they're worth developing in other areas of specialty.
Great. So we almost require, we very strongly encourage students to complete an undergraduate degree in communication science or something similar. Other universities call it different things in order to meet the prerequisite requirements for the program. But not everybody comes from that communication science undergraduate program. What other majors might a student complete on their path to speech language pathology, and what does that path look like if someone were to decide later on, maybe in their senior year, that they wanted to come into speech?
Mm-hmm. We see a lot of people who come through, again, education, special education, pre-med, linguistics, psychology, neuroscience. And if one is graduating without a degree in communication science and disorders or in communication science, they can complete the prerequisites in what we call the post-baccalaureate year or the post-bac year. And we offer a post-bac year that does not guarantee admission into the master's program, but that fully prepares you for admission or for success and proper matriculation into the master's program. So if someone did get a degree that was outside of the undergraduate degree of communication science, they would complete those prerequisites before they begin the master's program. But they can actually apply for the master's program before those prerequisites are fully complete, like if they're in the middle of a course or something.
And what experiences help a student stand out when applying to the program?
So one of the things that is talked about a lot in our field has been for years and is more and more viewed as a problem that is pressing to solve is our lack of diversity. We're a really homogenous group in general. Speech pathologists are about 92% white women. And so I think every program hopefully recognizes now that we need to bring people into the field who can represent those who are marginalized or underrepresented in speech language pathology, because speech pathologists serve the diverse US population. And we need to have those lived experiences in our clinical knowledge base. And we need those voices to be informing the field. So I would say that people who have different lived experiences, whether it's on the grounds of racial and ethnic category, gender identity, physical ability or disability, and so on, will tell a story that is unique and valuable to the field. On top of that, people who can just tell their own story, a cohesive story about how they view themselves being an active player within this field. You know, a lot of students try to kind of get the questions right and tell us what we want to hear. And that results in a lot of applications not standing out. So I would say just having a strong personal voice and being able to tell your own story is the way to approach the application.
Where on the application are students able to share that voice?
Oh, we try to design it so that it's kind of baked into every question. So we'll draft our prompts in our application that will hopefully tease out not just the student's voice, but also their unique experiences, which sometimes, you know, if you're a first generation college student like I am, or if you don't really know what is valued, we try to make it clear in the application prompts that there are a lot of ways to have and express your voice in a way that translates meaningfully to us.
Okay, one more question on the admission side of things. Do you require shadowing hours?
Yeah, it's required that all students coming into their master's program get these observation hours. And one of the things that I was going to say on the heels of the conversation about how difficult it is to shadow now because of COVID, there is something I'll put in the chat here called masterclinician.org. And this is available to students for $45 subscription a year. So it's pretty accessible. And it gives students a way to complete their clock hours of clinical experience and guided clinical observation by watching these master clinicians work with patients through this kind of network. So we do require that. And while it is challenging to find local observations right now because of the pandemic situation, this might be one good opportunity if you have a student who's interested.
Thank you for that resource.
Mm-hmm.
We are always excited to share resources with our advisors. So here is kind of a look at the average application admitted student final class. We've talked a little bit about how to stand out as an applicant, but how many Pitt students generally apply and are accepted to the Pitt SLP program?
That's a good question. Dr. Pratt might actually be able to give a better estimate of that, but I can tell you that we don't act with strong preferential treatment toward our graduates in the communication science program and the post-bac program. Some programs are really like, we want to keep our own into the master's program, and we really are looking for a cohort that's just a good fit because our program is rigorous and it's just not for everyone. We have kind of unique features that that will make us better for some students than others. So we're looking to optimize actual fit, and we're not really trying to meet a quota of how many previous grads come into the program. Dr. Pratt, do you know what the approximate numbers are?
It's usually about half of the students are Pitt. It varies from year to year.
Mm-hmm. And that compares with local programs that might have more like 90 to 95%.
Thank you.
Mm-hmm.
On to the outcomes, and then we'll open it up for questions. Are there particular specialties that you see Pitt grads moving into after graduation?
Well, one of the things our program is really known for is medical speech language pathology, and that's a function of the faculty that have been here historically and the fact that we are situated in a healthcare hub. And so our students are highly competitive for medical speech language pathology jobs, but also highly competitive for educational settings because we do have unique educational training settings here as well, and pediatric medical settings too. So it runs the gamut. I would say that we're maybe better positioned to graduate students into really competitive healthcare settings, but it's the full range.
All right, thank you.
Sure.
Now, do the advisors have any questions? Does anybody have any questions for Leah? Okay, thank you so much for joining us today.
Thank you.
We really appreciate your time. And we are going to move over to the next in the Communication Science and Disorders series.